Within passive range of motion, we are going to be doing the work for our client. As I've mentioned, one of the most difficult parts of passive range of motion is to get your client to totally relax during the movement. So if you feel any contraction during the movements, back off, move out of that specific motion, and then try it again, giving your client cues to make sure that they stay relaxed. Now, I would encourage you not to simply repeat yourself, oh, relax, just stay relaxed. One thing I do often is if, say, for example, I am passively going into dorsiflexion and I feel the tibialis anterior contract, I'll just tap onto that muscle and say, just bring your attention to this muscle right here where you feel my hand. Good. And just let it get heavy and loose and relaxed. Good. You use your hand and you cue them with where you're pointing and pressing to help them know which tissues to relax. Because they may say, oh, I'm completely relaxed. I'm lying on the table. Not knowing what you mean is, relax this specific muscle. All right. So now let's practice passive range of motion of the knee, leg, ankle, and foot. I'm going to start in the ankle this time because some of the motions for the knee require me to flip my client face down, beginning with dorsiflexion of the ankle. To perform dorsiflexion of the ankle, I will take my hand and I will cup the heel, and then the foot will then go down the entirety of my forearm. This top hand is going to stabilize the tibia and fibula. I'll make sure my joints are stacked, and I will move into dorsiflexion of the ankle, and once I reach the end, I will always apply end feel, that's that overpressure, and move out of that motion. Note that the knee is in extension. What that means is we're primarily stressing the gastrocnemius right now. We will assess the soleus more specifically once we flip our client over face down. So next we move into plantar flexion. Within plantar flexion, my bottom hand goes on top of the foot, my top hand firmly grips the ankle, and I will plantar flex the ankle as far as it goes comfortably. Once I reach the end of motion, I will apply a little bit of overpressure. Now that's plantar flexion. Moving next into inversion and eversion. Moving down to the bottom of the table. To perform inversion of the ankle, I begin by cupping the heel with my hand. My other hand goes on top of the ankle, and I will roll the ankle in. Once I reach the end of the motion, I then apply overpressure. Relax. Just bring your other leg up onto the table now for me. Good. Now the reason I shifted to this leg is to show you hand positions can be slightly different depending on what side you're on. This time, still gripping the calcaneus, other hand moving on top. Invert the ankle until we've reached maximal tissue stretch, and then apply overpressure. So that's inversion of the ankle. Eversion of the ankle, and I simply switch my hand position. So working on this leg, I then evert the ankle. Once I've reached the end of the motion, I apply overpressure. And to show you the hand position on this side, I'll drop that leg off. I again cup the heel, wrap my hand around, bring the ankle into eversion, and once I've reached the point of maximum mobility, I apply overpressure. Good. Moving now into the toes. To do passive flexion of the toes, standing, I simply curl the toes. Once I've reached the point of tissue stretch, I squeeze just a little harder, and you may have heard the audible cracks, which is very common when we do flexion of the toes. An extension, using the palm of my hand, I curl the toes into extension, and once I've reached tissue stretch, I apply overpressure. And then we could move right into passive extension of the knee. We do so in the same position, and as we know, we work in the ankle and then move up into the knee next. So the first thing I'll do is take my top hand and press just superior to the patella. Now this hand is going to be applying firm downward pressure. Now my bottom hand is just going to curl underneath the leg, and I don't need to grip firmly onto the ankle, so I'm just going to leave my thumb out of it. Now with this top hand firmly in place, applying downward pressure, I slowly hyperextend the knee, and once I reach the first level of mild tissue resistance, I make sure to check in with my client, see if there's any signs of apprehension. As always, I pause there for a second, and then apply overpressure and hyperextend the knee. Now that's passive range of motion with my client supine. Now I'll get them to flip face down. So if you would, please flip face down. Good. So with your client face down now, we can perform passive range of motion of flexion of the knee, and we could do dorsiflexion, focusing more on soleus. Continuing on with the ankle though, I will work on soleus first. So we bring the knee up into flexion. I'll use my forearm and hand. I'll grip the calcaneus. Slowly bring the ankle into dorsiflexion. And if you need to position your arm or hand a little bit differently to be more comfortable, do so. I continue until I've reached maximal tissue stretch, and once I have gotten there, I pause and apply overpressure. Now the reason I pause there is if we move too quickly into a passive range of motion in which I am stretching a contractile tissue, we can elicit a reflex reaction in which there will be rapid plantar flexion. So when we have a contractile tissue or a muscle, we'll stretch it. Once we reach that stretch, take a moment, pause, and then apply your overpressure. Moving now into passive flexion of the knee, we then just passively bring the heel towards the buttocks. Once we've reached the point of tissue stretch, we again pause and apply a little bit of overpressure. Good. Of course, I will repeat myself many times, but during any range of motion testing, make sure you constantly communicate with your client. If there is pain at any point in time, stop, and that indicates a positive. Hey, thanks for watching, and don't forget to subscribe. If you would like to learn more about orthopedic assessment, click the link in the description below and register for a free training on orthopedic assessment, where I'll take you through my entire assessment process beginning to end, step by step, and teach you my 3 secrets to get more out of every session with my clients. I'll see you there.